Well, I will jump in and get started and let others join in as they are able. Thank you for coming and not just sitting and getting, but being an active participant in today's webinar. We titled it Centering Equity Using the Comprehensive Learner Local Needs Assessment. I love learners. To recalibrate career and technical education. And we're trying to really, I think today, focus in on some of those items that, you're still trying to, maybe you're brand new to the CLNA process and you're like, I don't know what that means, right? We have resources for that. But also if you're engaged and have been engaged in the process and you're like, it's not doing necessarily what I need it to do. We have some people who are here that have really, we think, worked to center equity into their CLNA process. And we want to make sure that you all get a chance to hear from them and maybe ask them some questions about how they were able to do it. We also invited, we have Dr. Ashley Anglin, I believe I'm saying that correct, from the United Way, the United for Alice piece of this. As we've gone out and about and heard about different populations that are not just in our communities, but on our campuses, we have heard a decent amount around Alice, and I'm sure she'll describe it in more detail and what we've been thinking about it. But we wanted to bring this to you all to think maybe a bit more about this population that shows up on your campus, right? There's a lot of intersectionality that we see of our students, of our learners, and this is another aspect of it. And so we want to at least give you an opportunity to explore this population and think through some of their needs, right? In addition to thinking through your CLNA process itself. And so with that, I'd like to at least start out. I would like to give it a full, more formal introduction of our guest speaker. And you will have an opportunity to ask questions. So save those, add those into the chat function. We will make sure that they get asked. If you don't want to, if you want to do it anonymously, send it to myself. We also have Kuneyl, who is helping with the panel moderation from OCCRL. And Jewel will be joining us. Jewel Bourne is the main contact for much of this work has been, will be joining us as well. So send us your questions or ask in the chat and we'll make sure that they get answered. But Dr. Ashley Anglin is the Director of Research and Strategic Analysis for United for Alice. In this role, she conducts research, writes reports, and supports the development of new Alice tools and collaborations. Her aim is to ensure that all reports and tools are accurate, engaging, accessible, and lead to action that helps Alice households. Same. Many of us do the exact same thing. I'm very excited to have her here, if you can tell. Ashley is a community and cultural psychologist with a master's degree and a doctoral degree from the University of Hawaii at Manoa. She also holds graduate certificates in public policy and executive philanthropy. And so with that, Ashley, I'd like to turn it over to you.
Great. Thanks so much for the introduction. It's awesome to be here today. We love to present to different groups, and actually community colleges are not a new partner to us. And so I'm hopefully sharing some basics about our research, but also hopefully sparking some ideas of what's been going on in other places across the country as well. So I'm going to share my screen and make sure you can see it. Let's see.
We can see it.
You see that? Okay, perfect.
Thank you.
Yeah, absolutely. Okay, look at that. All right, so for today, just kind of a brief overview of what I'm planning to talk about, but feel free, again, jump in with questions. I think it's a small enough group that if you wanted to unmute and ask me a question, that's totally fine, or use the chat and Q&A. But I'm going to start with an overview about United for Alice and who our organization is and how we came to be. I'll talk about the population of Alice households, and some of the challenges they face more broadly. And then we'll also talk about some of the Alice data for Illinois to kind of set the ground for what is that extent of financial hardship in the state. Then we'll talk specifically about Alice students and community colleges and some ways that I mentioned community colleges are already acting for Alice across our partner network. So speaking of that network, we are currently in 28 states in the District of Columbia and growing in this partnership. This project started as a research study in one county in New Jersey, where we were seeing really low rates of poverty, But social service agencies kept saying that can't be right. Like, people are coming to us because they don't have enough food. People are coming to us because they can't afford their rent. And there was a lot of need, but not data showing that need. And there was really this belief that that federal poverty level is really woefully inaccurate and misleading when it looks at really what is the extent of financial hardship across the country. And so starting in that one county, we calculated what are those basic costs and then compared that to what people are making to see, is there a gap? And how many of those people are above that federal poverty level, but still not making ends meet? And so we started that in one county, but now we have data for all 3,000 counties in the US. And we have those partners in those states that I mentioned who are really advocating, convening, innovating, and working in their local communities. Most of our partners are United Ways or state associations of United Ways, but if you're familiar with United Way, their partners are broad. So all of their board members and business partners and sponsors and individual donors and groups, so they're all involved. And so we want to do with this is really have a common language and a common movement to unite us in that purpose and help us really highlight a population that we say has been hidden by official statistics. And it's a population that we're all very familiar with, I think, if not by name. Because ALICE households, it's an acronym that stands for Asset Limited Income Constrained Employed. The technical definition is those households with income above the federal poverty level, but below the cost of basics in the county where they live. So we calculate a basic household survival budget, which I'll take you through. And then we look at that county by county in the US and see the number of percentage of households that can't afford those basics. ALICE is often working, often multiple jobs, often in essential jobs. ALICE workers were really praised as heroes and essential workers during the pandemic. And we saw how important they are to maintaining the smooth running of our economy. They're our neighbors, they're our friends. Some of us might be ALICE. And these households have, despite having such an importance in our economy, often have little or no savings for emergencies or for future investments. And that includes education and furthering their education. As a group, we see some specific challenges, and there's a lot, so I won't get into them too much right here. And I think a lot of you are probably familiar with this, but one of the biggest challenges is that by concealing the extent of financial hardship and by using the federal poverty level to set benefits programs and assistance programs and other types of public services, where this group is generally not able to apply for public assistance. They're not eligible for additional supports, as some households below the federal poverty level are, but they're still struggling day to day. And we're seeing kind of over time that wages just aren't keeping up with that cost of basics. And we measure our ALICE Essentials Index, where we look at just the cost of basics over time. And what we see is that those essential items, their costs are increasing much faster than overall inflation. So again, concealing that struggle for ALICE. And because of that, inflation hits ALICE harder. We also know that crisis hits ALICE harder. If you have fewer resources, savings, insurance, the ability to move or other types of supports, natural disasters or a pandemic can take you from barely getting by to really struggling. And because of this, we also see elevated symptoms of anxiety and depression and other chronic health issues within the ALICE population as well. So some of the key terms I want to share, just to kind of set the understanding of where this research is coming from. Some of our key terms include our survival budget, which I'll take you through. We also have our ALICE threshold, and really what that looks at is that average income needed to afford the basics. And what we really see is that ALICE plus poverty is the most meaningful measure, because that really captures all those households that are struggling, and we call those households below the ALICE threshold. If you're interested in our methodology and want to dig in more, that's on our website, so unitedforalice.org/methodology, and you can get more details than you probably ever wanted, but we include everything there. We really want to make sure that our methodology is really transparent, that it is replicable, that it is accurate, and so yeah, feel free to dig in if that's of interest. When we look at these measures, probably the basic one and the most important one that our partners use is our ALICE household survival budget. And so what that is, and I've mentioned it a couple of times, it's that minimum cost to live and work in the modern economy. It's the basis for determining whether households are above and below the ALICE threshold, and it includes housing, childcare, food, transportation, technology, healthcare, taxes, and a miscellaneous fee to cover overages. This is not a aspirational budget. It is meant to be the bare basics. And the reason we do that is because even with this very minimal budget, we still see 41% of households across the US unable to afford the basics. We don't want to be seen as overestimating, so we're really just looking at that kind of what is that bare essentials. So, for housing, that's looking at fair market rent. Childcare is looking at home-based care for children and after-school care. Food is a thrifty food plan from the U.S. Department of Housing of Agriculture. Transportation, if it's public transportation, if available. If not, it's the cost of an older car and running and maintaining that car. Technology is a smartphone plan. Healthcare is the employer contribution to an employee-sponsored plan at the low cost, and then taxes are state, local, and federal taxes that apply. So really just kind of this basic budget. It's adjusted by household composition and location. So that's one of the other kind of gripes we have at the federal poverty level, is that it's the same everywhere, and it's adjusted by number of people in the household, but not household composition. So as you can imagine, the cost for a household with 2 adults and 2 children is different than the cost for 1 adult and 3 children, right? It's a different type of budget that you're maintaining, and so we adjust our budgets for those household compositions, and really kind of any combination you want to make. We have a budget calculator on our site as well. If you want to learn more about that data for Illinois, for any of our partner states, I put that link here, unitedforalice.org/household budgets. So across the state, when we're looking at just that breakdown in terms of where households are grouped, so what we end up with is 12% who are below the federal poverty level, an additional 24% who are ALICE, for a total of 36% below the ALICE threshold. And so that's a big chunk of the population that, kind of without looking at these costs compared to what people are making, we're really missing out on seeing that group of people. A lot of folks would call this kind of the working poor, but what we're doing with this acronym is trying to include more people to identify, as being ALICE, because it really, when you see these numbers, it's not a individual or personal or moral failing. It is a systemic issue that is affecting 41% of households across the US and 36% of households in Illinois. It's something that it's going to take more than just, kind of individual attention. So we want to bring that up to the forefront. There's a lot of variation by geography, as you can imagine. So here looking at, we have a lot of maps on our website that you can take a look at, but across the state, you can see the lowest percent of hardship in Menard County at 28%, Monroe County 30%, and highest in Alexander County at 66%. Illinois ranks 10th in the nation, so 10th best. So one is the lowest percent of hardship, and so number 10. And I think it ranges from in every state, at least 1/3 of households cannot afford the basics. So it ranges from 32% in Alaska to 52% in Mississippi, one of our newest partner states. The regions with the highest percent hardship is the South at 45%, the Midwest lowest at 37%. There is also a lot of variation when we look at the demographics of households in hardship. Usually the largest number of ALICE households are in the largest demographic groups. So for example, in Illinois, the largest number of households were white, making up 32% of white households. But we see other groups with disproportionate rates of hardship, and really a big range as a result of systemic racism, ageism, sexism, and other factors that impact households' abilities to make ends meet and support the basics over time and across generations. So we see the highest percent of hardship when we look at race ethnicity among Black and Hispanic households, and the lowest among white and Asian. I'm sorry, I forgot to put the percentage there. I can pull it up. For Asian, I think it's slightly lower, maybe 28 would be my guess. And then by age, we see the highest rates of hardship in the youngest and oldest households, specifically those households headed by someone under the age of 25, which might be a lot of your students. And so we see a high rate of hardship there, but also seniors. It's lowest among working age folks, 45 to 64 at 29%. By household composition, single parents have the highest rates of hardship, most notably households headed by single females with 68% below the ALICE threshold in Illinois. Married parent households with dual incomes, you see 14%. So a big difference there in terms of the number of adults in the household able to work and support those basics. So looking at some of the challenges and things that we've been seeing around ALICE students when working with our partners, again, these might not be, this might be not new information to you, but I wanted to kind of bring it up here in the context of ALICE, because when talking with our partners, we're seeing a lot of kind of changing economics and demographics of college students, especially when we're looking at those students who are from ALICE households. We're tending to see older ALICE students tend to be employed, often juggling family responsibilities and other responsibilities. And because of that, often have different needs than traditional post-secondary students. And so a lot of our partners have been really focused on trying to identify what those specific needs are in their student populations, and to help kind of meet them where they are and change some of their practices. And I'll show you some of those examples too. But a big part of it has been kind of rethinking the why behind certain things that happen in academics. And I grew up on a college campus. Both my parents were professors, and kind of questioning, like, we've always done it this way, and then the why. And sometimes the way we've always done it is because that was a population that we were serving and that had those needs at that time when some of those traditions and policies and procedures were put into place. But with that changing demographics and this ALICE need growing, which it is across the country, rethinking that and kind of saying, why do we have these particular classes in these particular order at this particular hours? And so those are a lot of the questions that our partners have been talking about lately. And also just the skills needed in the workplace are constantly evolving. And so really the importance for timely and accessible training opportunities, to be really responsive as opposed to, kind of slower to respond to some of these changing needs. And also, I think a lot of our partners really recognizing that they can't do it in isolation, that partnering with local employers and others and finding out what those specific needs are and where the jobs are and what where the gaps are can be really helpful in kind of defining that and strategizing around that. As you probably can guess, some of the barriers for ALICE students that we've been seeing are obviously costs, but not just tuition, other basics that are needed in terms of, supplies and books. Transportation is a big one, and having reliable transportation, being able to get to where you need to be, at what time you need to be there. And we know that, a lot of times ALICE households are kind of one like car breakdown away from not being able to go to work or school. And if they can't afford that repair, that could be an extended period of time. For something, that could be as simple as, getting someone to class, right? So there's a lot of challenges that we hear about there. Food insecurity. I know a lot of our partners have food pantries on campus or have partnered with others, including United Ways, to help provide basic foods, because we're seeing that kind of need growing in a lot of places. And I'm curious to hear from you all if that's something they're seeing as well. But, we kind of say that the food services like that are really kind of the canary in the coal mine. Like if you're unable to afford kind of base your food, there's probably other issues in terms of your financial stability and everything, right? It's a ripple effect. Those are so basic. Housing affordability and being able to access housing close to where you go for school or for training. Childcare and elder care needs. I know it's a big and growing need and issue that students have, and they're juggling needing to provide for care. We've been doing a lot around assistive technology for caregivers, like cameras and Ring doorbells and things like that, because so many people they have to go to work, they have to run their errands, but they have people at home who need more supervision or care than they can afford or provide. So that's a big thing that people are struggling with and we're hearing about. And then also their own healthcare needs or ability to kind of meet those needs and have basic care. So gloomy things, yes. But I'm very hopeful because I think a lot of partners are really kind of activating and using this data and other, data sets and tools and resources to better understand their populations and to start really thinking innovatively about how to address some of the things that we're seeing. So these are some examples that come from our ALICE in Action database. I'll show you what that looks like here. Just pull it up really quick because it's a great place, I think, to find information, but and I'll put the link in the chat as well. But these are some of the programs and practices and policy changes that are our partners are doing, United Way partners specifically, but who are using the Alice data. And so we have, I just typed college in here because it's a keyword. I think there's like 150 total, but I kind of zoomed in on some of the ones that our community college partners are doing. One recent presentation, Dr. Stephanie Hoops, who is our national director, she presented, I think it was last year, at the American Association of Community Colleges, and presented there with chancellors and presidents from California, Wisconsin, Louisiana, talking about some of the things that, really going over some of the needs for Alice, but also thinking about what we can do about it. And that was a really awesome session. So we like to do more things like that as well. Cleveland State Community College, as a result of the data, had implemented raises for their Alice employees. That's another thing I wanted to mention, is that often Alice is also working in our institutions, and we have an Alice at Work initiative where we're working with businesses and corporations to look deeply into their staff, looking at for any gaps in terms of wages and pay, and estimating the Alice population within their staff. And for most groups that we've done this with, it is really eye-opening and motivating for some. So in this case, the chancellor there used those thresholds to adjust the compensation for employees. Another example comes from Virginia's community colleges. They have a program called G3, Get a Skill, Get a Job, Get Ahead. And this provides free tuition and basic needs support for Alice students. And so they are working to define who those students are and to provide them with basic services. I'm just going to see if I had an example of what some of those were. Yeah, so working to learn new skills and obtain higher degrees in high demand fields. And it provides transportation, childcare, and other supports to help toward degree and certification completion in Virginia's community college. And so they said that data suggests that students who complete the program can expect a 25 to 50% increase in wages. So they're also looking at kind of what that trajectory looks like for those students as well. We've also been engaged in some joint advocacy for the workforce Pell and that legislation, and activating partners in that space. A lot of our partners use the Alice data for policy and advocacy work. We also had this great program called Michigan Reconnect. That was one that was presented to at that conference, but that's looking at free tuition to programs in high demand occupations at community colleges. So looking closely at kind of what's in demand within the state and with different areas, and really emphasizing those within training programs and bringing that together, which is really great. Again, a lot of food support services. So Magic Food Bus from Middlesex Community College. It's a new food pantry that provides food and snacks both for staff and students. And it's intended to kind of address food insecurity in the Alice population. Elevate Brevard. So there's another, a lot of groups are convening collaboratives around this topic in their communities. So this collaborative, I think it started in 2020 as part of the Florida College Access Network. And so they have a bunch of different partners, and they're working to increase college credential attainment and to close employer skill gaps. And then several different community colleges are also using the Alice threshold and scholarship criteria to kind of expand eligibility for scholarships and other supports. And we see this across other organizations as well. A lot of nonprofits say, okay, we're not going to use, 120% of the federal poverty level. We're going to use the Alice threshold, or we're going to set this. And so that presents an opportunity to kind of expand kind of the definition of need to be able to expand resources for those students. As I mentioned, you can go to unitedforalice.org, Alice in Action, to get some additional ideas, but those are some of the big things that we're seeing. We're also really excited to be convening our first big in-person conference, In Step for Alice, that we're presenting. That's January 29th through 31st. It's filling up fast, but if anybody here is interested in joining, check out that link there. And we're still open to people joining us in Louisiana and New Orleans in February, which weather-wise should be nice. So if you want more information about that, you can check out the website as well. All right, so I'm going to stop there because I would love to be able to answer some questions. And I would also love to take this opportunity to hear from you all about, does this resonate? What is similar in terms of your experiences? What is different? What are we missing? Because yeah, I'll be continuing to have these conversations with other partners and would really love to be able to share your perspective as well. So I'm going to stop sharing my screen, but if you do need me to show anything or you want to see the website or anything, I can pop it back up, but I'd love to be able to see you all. So questions, thoughts?
Yes, please feel free to unmute and ask or add in the chat. I appreciate your reminder, right? And we often not forget, but it's just not top of mind that we're not talking about ALICE just for our students, but also for our employees. Being very conscious of that. So I appreciate that you continue to bring that to attention.
Yeah.
So for those in the audience, did this resonate? If you have further questions, go ahead. I saw that you unmuted. Go ahead.
Yeah, one of the things that I thought was really interesting is there's a section in the Comprehensive Local Needs Assessment, which really addresses the issue of current college policy and procedure in terms of addressing some barriers. Are there things that would prevent the assistance? And I could see this really playing a role there, and introducing that when we do our open forums and such in the upcoming years. We're preparing a new comprehensive local needs assessment for the application.
Makes a lot of sense. How many of you have United Ways in your that you're at least aware of and know of? Maybe have already a connection. Maybe raise your hand in the using the reaction to be interested to see connections with United Ways. How many of you have heard of ALICE as presented? Anyone?
Got a few hands. There's one.
I see a hand raised by Anna. Please go ahead. Well, she was probably just raising her hand for ALICE, but maybe she has a comment as well.
Okay, well, I'm glad there's some new, some people that are new to ALICE too, because I think, yeah, there's really where we start usually is around just like highlighting the needs of this population, but there's so much more. We have a lot of tools on our website. We have our newest economic viability dashboard. We have our legislative tool. We have, our wage tool. So there's a lot of different things, but I think just kind of when people are usually the response we get when people are learning about ALICE for the first time is they're like, yes, I absolutely know who ALICE is. I haven't had this definition. And yeah, I know ALICE. And for a lot of people, it's saying I am ALICE. Whereas somebody, when we talk to people and they say, oh, they don't want to say I'm not poor. There's people worse off than me, right? Like I don't need this, or especially people in this population who know they're like, I'm not in the federal poverty level. Like I'm not, someone else needs it. But when we say, are you asset limited, income constrained employee? Like, are you like working hard or struggling to make ends meet? Like, or are you, and they're like, yeah, of course. And, do you feel like you're working paycheck to paycheck? Like, yeah, absolutely. You're ALICE. And they're just like, oh yeah, I'm ALICE. And we have, we started our ALICE lived experience committee and advisory council. And that's just been such a big part for them, because it's like, oh yes, I can identify as this, and then also like do something to make a difference. And sometimes that's as simple as telling someone about ALICE. Yeah. Tony, did you have a question? Is that hand?
Maybe.
Yeah, my guess would be you all have United Way somewhere in your footprint. There's I can probably find the link real quick, but there's a Find Your Local United Way link. But luckily you do have a little bit of an in now that I know you all. Hello, I can connect you to our ALICE lead for the state of Illinois, Ethne, who works for United Ways Chicago, Metro Chicago, and United Ways of Illinois. So we do have some connections. And so if you're just curious of, who's your local United Way, what are they doing in this space? Are they working with ALICE? Yeah, let me know. I can definitely make some of those connections too. But yeah, usually I find that they're looking for partnerships and love to have support, especially I think for from community colleges and others within their communities who are serving a lot of ALICE folks.
There's a question in the chat that says, have you been able to differentiate the ALICE criteria from, say, 6 years ago?
Yeah, so we do have data available over time. And so one of the best ways to kind of look at that is looking at the report for Illinois, but on our website too, we have lots and lots. But what we've been seeing for the most part in Illinois and across the country is basically after the Great Recession, the percentage of households who are ALICE jumped a lot and stayed at this plateau, kind of up and down over the past during the recovery, right? So like, but we saw poverty kind of tick back down. Things are changing now. We had a pandemic, and now we're about to see the 2022 data for the first time at the end of this month. We're holding our breath to see what happens, because we know 2021 was a unique year where there was a lot of additional supports that ALICE was eligible for the first time ever in terms of economic impact payments, child independent tax credits, child tax credits. But we know that's back to pre-pandemic levels again. And so we've seen a lot of warning signs on the horizon that it's getting worse. And so, while poverty kind of was able to kind of tick down in the recovery, ALICE increased and just has not gone down again. And so that's the trend that we've been seeing. And yeah, like I said, we're a little concerned about what the next data year might show. I'm going to put in the chat a link to the website for the state overview page for Illinois. There is so much data. You can get down to the county level, down to the zip code level. I really recommend taking a look at maps, the maps tab in particular, because you can look down at, zip code or municipality, and then map on top of that different resources that exist. And it's a great way to kind of see that need and really look at it within your footprint. You can combine multiple counties to look at a regional budget. There's a lot you can do. So I'll put the link in the chat, but I think the best way to do it is kind of to explore it on your own, take a look, and then reach out with questions if there's anything that you're looking for that you can't find. But and that's where you would get that really great granular data for your needs assessments and things like that is on the website.
Makes a lot of sense, and that link will be very helpful. Thank you for that. And I was glad to see the different partnerships that you have with community colleges. Obviously, those are ones that, through looking at their needs assessments, they've said this is what we need. Should, as people are looking through their data a little bit more, should they reach out to their local United Ways to think about maybe partnering, or how do they maybe jumpstart some of those connections?
Yeah, definitely. I mean, I think reaching out directly, if you're unsure of who to contact and, want to talk through the state lead, we can definitely make that connection as well. But yeah, there's always opportunities, and we have a research advisory committee that we convene for every single state. So we have a lot of researchers. So there's a lot of opportunities to engage. But I think at the local level, talking to United Way, seeing what programs they're already doing. But a lot of them see themselves as community conveners and are just ready and interested in those types of partnerships. So yeah, I would definitely say reach out and start having those conversations, especially if you're in the midst of doing that needs assessment process and really using them as a key informant in that. I'm sure they have a lot to share in that space too.
Appreciate it. Any final questions for Dr. Anglin? I hope that many of you have found this again informative, and potentially as you're going through and disaggregating your data, potentially this is a population that you keep an eye out for, and maybe even seek to again see what it even looks like on your own campus, and then potentially think about some ways that you can help remove barriers for such students. This is just another way to disaggregate your data. And so thank you, Dr. Anglin, for joining us this afternoon and helping us think through this I think important population on our campus. And like you said, it's growing, and so we have to make sure that we're aware.
And I'm going to put my email in the chat. Y'all are welcome to reach out if you have additional questions. I always think of my good questions like an hour later after the meeting. So if that comes up, feel free to reach out.
Always. Thank you. I'm sure we'll be in touch.
Great.
And so with that, we are going to move into the next section, which allows us to hear from some of the people that are doing this work right every single day around us. know it very well, and have some, I hope, some really good advice, right, in helping you think through that next. And so I'll turn it over to Kuneyl, who will introduce our panelists as well as moderate. And I'll ask you again, jump into the chat, throw it in there. We'll make sure that your questions get answered. So with that, Kuneyl, please.
Howdy. Thank you. All right. I'm actually gonna spin this a little bit differently. I'm going to see if they are willing. Could we have our wonderful presenters do a brief introduction of themselves? If you wouldn't mind, just include anything you want or that you feel is relevant, but some ideas of what you might include would be your name, pronouns, where you are currently working from, and your context to CTE. And unfortunately, you are a bit scattered on my screen. So whoever is feeling bravest, I'm gonna ask that you jump first.
Hi, I'm Jonita Ellis. I am the Career and Technical Education Program Improvement Manager for the College of DuPage. I've been in this role at College of DuPage for over 12 years. I have probably over 30 years of experience working with career and technical education programs, as well as working with Perkins. Here at the college, my primary responsibility is twofold. One is I manage the Perkins grant for the college. And my second responsibility is I manage the program review process also for the college. And they really do go hand in hand, being a continuous improvement model, which we really use for both. So that's my experience. And I also obviously would coordinate and facilitate our comprehensive local needs assessment here at the local level for DuPage County.
Wonderful, thank you so much. Who would like to go next?
Go ahead, Cherie.
I saw you were unmuted. Hello, everyone. My name is Cherie Meador. I'm with Moraine Valley Community College. I've been with the college for about 4 years, but in higher ed for about 20 years. I work closely with faculty in the CTE programs around program review, curriculum development, and assessment. Primarily with program review, I've worked with various colleges over the last couple of decades. So I'm also part of the PRAC committee, so a proud member of that committee, and we have been centering equity around our program review work. Thank you.
I'll be the last one. My name is Cathy Taylor. I am the Dean of the Sustainability, Business, and Career Technologies Division at Elgin Community College. And what that really means in a very short sentence is our division pretty much contains all of the CTE programs at the college with the exception of health professions. I've been in the role now for about 5 years, and I've been in with the college for 10 years. I've had some peripheral responsibilities with Perkins. Actually started out as a Perkins administrator, but it was only for a short period of time. But then has transitioned, as I transitioned into the dean's role, that particular responsibility was then handed off to another individual at the college. We have recently moved our Perkins administration or Perkins grant to an institution-wide. Prior to that, it mostly sat in our division. But as a result of us moving it institution-wide, we have now been able to work with the CLNA, using that to really inform how we move forward with Perkins, allocating monies to our various programs, but more importantly, ensuring that our programs are relevant to industry need.
Thank you so much for sharing and all of that great detail. It really helps us contextualize our questions and focus them towards the best person to answer. All right, give me just 1 second. I have too many tabs open. There we go. So let me start off with this question. You've kind of hit on this already, but we'll go ahead and fully flesh it out. Is what is the specific responsibilities that fall under your purview within your institutional context in relation to CTE?
And jump in there. So at Moraine Valley, I'm the Dean of Academic Services and Strategic Initiatives. In that area, we, as I mentioned, curriculum development, we help programs really think through courses, redesign, develop new programs. And in that, all of that is really part of program quality. So we look at everything from the assessment of student learning and planning of that, as well as data collection around those areas, program review. And so I do work across the college with all faculty, but specifically as it relates to CTE faculty, we work really close to develop new programs. And I think as far as the context in our college, we have quite a few programs. We have over 102 certificate programs and quite a few degree programs. And so we have deans that oversee those career areas, 2 separate deans. So they're sort of split in different areas, science and business and technology. And then we have a career program area that oversees health sciences. And so I work closely with not only faculty, but the deans. And then we also are structured where we have a resource development office that oversees our Perkins grant and the CLNA process. It really is a collaborative process at our college. And we have a committee that provides data and information and updates as it relates to our CLNA. So we are probably structured a little different, but in some aspect the same way, where Perkins may be in a separate office from a CTE dean or another service office. But we do have to collaborate to, as you know, to really complete that extensive report. And so that's how we're structured. I'm not sure I would be interested in hearing from some of my other colleagues. I know we're different across the state.
Yeah. Here at COD, we're structured in a very similar way. As Cherie mentioned, we also have quite a few, a number of programs. We have over 250 CTE degrees and certificates, and we have divisions in career areas. CTE probably hits every single division across our institution. Like Moraine Valley, we also do work in collaboration and in teams. We extensively integrate our existing programs for our CLNA as well. We work on a structure where we have a steering committee, which includes members of our Perkins steering committee, but really is comprised of a cross-institutional team, which includes our provost leadership team, our research office, as well as our key external partners on that steering committee. So we have our representative for our education for, our employment for education for employment director, which is our career center for our secondary programs, the Technology Center of DuPage on our steering committee, as well as members from our Workforce Investment Opportunity Act, our one-stop center. We have a few members on that committee as well. In addition to the steering committee structure, we also implement during our comprehensive local needs assessment. We also implement 4 working teams, which again is comprised of both internal and external partners. Those are broken into groups that are really related to the comprehensive local needs assessment tool that we complete. So we have a labor market alignment working group team. We have a special population access and success team. We have a data trends and student and program performance team that looks at data trends and gaps. And then we have a program of study team. And each of those areas, we're looking at specific data and information to take a look at equity to see if there's equity gaps in those regions. So when we're looking at the labor force, we're looking through our Lightcast data to see if certain occupations have equity gaps, either on a gender or on a race or ethnicity level. We do the same thing when we're looking at student performance. One of the extra pieces that we do for our comprehensive local needs assessment is that we really do a program review, but as a CTE aggregate, and looking at all those same measures as well. So that's one of the things that we do to make sure that we're really using data to help direct us with making sure that we're meeting and assessing the needs of the community in regards to career and technical preparation for the career force.
And so as the dean of a division that comprises 19 different programs that are all CTE programs, career tech education programs, I also have responsibility for curriculum development, program development, as well as assessment, program review, program of study tool. At least we work in collaboration with our Perkins administrator. But we also, as a division, work very closely with our workforce development division. And that's where we center equity in a lot of our decisions. There's the WIOA component that we have as well, very similar, but we use also our affiliations with local associations and including economic development groups. I know in the past that we have met with those economic development groups and used the opportunity to talk with local employers about some of their talent acquisition needs and how then could their experiences help to inform our comprehensive local needs assessment. So we are doing a lot of different things that help us to bring it more collaborative. And I think we've learned some things after the first time around. One of the things that I would also point out is that I also believe that as a document that, it's one of those things that should have consistent review. And I likened it to a SWOT analysis for a business or a business plan for a business. And with the fast pace of change that we've all experienced over the last 4 years, especially brought on by the pandemic, it makes sense for us to look at these CLNA documents more frequently as opposed to every 2 years. And so we'll be looking and exploring some of those opportunities here at our college as well.
I'd like to add to what Cathy just brought up. I think looking at it, every 2 years obviously is not going to be useful for the college, especially if you embedded a lot of this into what you do already. Mm-hmm. You're doing the work and you're measuring to see where there are still some lags or gaps, even in the data needs that you may have for your college. So we have a call for updates twice a year, and we have a meeting. Our resource development office really does bring together that collaborative group, and they are asking for updates on progress. Like, where are you with this? You said you would do this. This is an initiative, but a lot of these are things that we do already. And that's great because then you can operationalize it. It's already something you do and you're planning towards. So our faculty, if they have a grant for a program, this is embedded in what, their action items are. A lot of this is also linked to our strategic plan. So I think that's important to point out that if you really make this a part of what you do for the programs to ensure there's equity throughout, there are support services. It's linked to more than just this particular plan, but it's linked to your strategic plan, your budgeting process, all of those things.
If I could just add to what Cherie just said, if we even think about just the population shifts that have occurred just in the last 8 to 10 years here in the state of Illinois, it makes sense to look at these more frequently. And I just wanted to reiterate that fact because I do see that, for a community college and especially for higher education, we and community colleges have to be more responsive to our industry partners. Our industry partners are looking at their plans every 90 days because technology is forcing change. And so as community colleges, I think that it is in our best interest to take a similar approach, and where we can make those adjustments and operationalize various strategies and tactics that we're putting down on paper, because you know, it's just one thing to put it on paper and leave it sit there, but it's another thing to go back and activate it.
Right, and I think to echo with both what Cathy and Cherie are saying, is this integration of using your existing processes and procedures. I think both mentioned that they use our strategic long range plan. We do too. Your comprehensive your comprehensive local needs assessment really, can utilize existing things, including if you have equity plans. I mean, your equity plans have already outlined some issues, some gaps. Incorporate that right into your report, because that's what's going to make it really meaningful for folks. So it doesn't seem like you're duplicating efforts. You're really using existing resources and adding that information already there. And the larger you spread that net of collaboration among both internal and external partners, the easier it really does become, because you're able to get a broader perspective, but you're able to get their expertise as well, and you're not reinventing the wheel. A lot of the things that are needed in the comprehensive local needs assessment, you already have access to. So if you're not utilizing your state plans, if you're not utilizing your WIOA local plan as well as your WIOA state plan, those are excellent resources when you're building and working as a collaborative group and developing that comprehensive local needs assessment. And I truly appreciate it with Cathy and Cherie saying that this is a living document, and it's, it kind of equated almost to when, the Higher Learning Commission, every time you do a self-study or self-assessment, you think it's one and done. It isn't. It's something that's really a continuous improvement that you're looking at frequently to make sure you're taking that pulse, to make sure you're on target.
Mhm.
I love the way y'all are feeding off of each other, and you're already segueing perfectly into my next question. But I want to go ahead and ask it just in case there's some points that you really want to drive home for our guests today, which is, how do you center equity in your process in CLNA?
Well, I think both Cherie and Cathy have mentioned that we have looked at aggregate and disaggregate data consistently for a while at our institutions. We do it in program review, and we also incorporate our Perkins and other issues within our program review process as well. We've implemented annual updates, and right now, one of the things that we've identified, obviously, in the past when we're looking at aggregate and disaggregate data is, are there programs where there are certain populations that are underrepresented in participation? But now I think we've even extended that farther, as we're not only looking at access and retention, but we're also looking at completion. Are there differences? Are there equity gaps for completion? And then what are those barriers that are causing those equity gaps, so that we're able to address that accordingly? And that's here at the College of DuPage. We now have a completion committee that's their charge. It came out of our career pathways. And so again, we're incorporating the work that they're doing. We're not reinventing it, but we're putting it all and making it all integrated, that we're able to do that.
And I would just add that as a state, so much of what we've been focused on for the last several years is equity. So we've seen the shifts with program review and the template.
Right.
In my office, we work with faculty in very small groups, but we also have a large workshop, and we talk about this. And last year we decided to do like a data equity workshop specific for program review, because we know that the data exists, but sometimes faculty may need assistance with how to, I analyze this data. How do I make sense of this? Are there gaps? Do I need additional data? And our research office has been very instrumental in making sure that we have that data. As part of an Equity Academy project, there was a data dashboard created to focus on subpopulations, because much of what we need from both the CLNA and other processes is we need that data that's disaggregated at the subpopulation level, so that I know the support supports that are needed for students of diverse populations, are programs perhaps that are lagging in areas where there is gender inequities, or there's a need in that field to increase a particular gender or background, and that information really comes from data. And I know that that may be different for every college. The resources, we've had this discussion before in our PrAC committee meetings, that those resources really do vary. But identifying the gaps in data will help us identify the gaps in the needs for our students. So I would say centering students, and you can't really center that if you don't know what the data is telling you about your students. And so I definitely think that if there was anything that you would want to focus on as you move forward, is what are the gaps? Not the gaps that you see in the data you have. Are there data gaps? Is there a missing piece to what you need to know?
And I think I would just add one more perspective to this, in the sense that when we're looking at the equity gaps, disaggregated data, aggregated data, and we're all trying to make sense out of it, because keep in mind, everybody brings a different lens when they're looking at the data. But I think that there's one other piece that we all have, and that is the ability to self-reflect, to do some introspection, and then think about how we can implement or affect change at the institutional level. And that, Cherie just said a very, important thing. We've been talking about equity now for a long time, and some of us are seeing the needle move. Some of us are not seeing the needle move. Some of us don't even know what to do to move the needle. But I think my point is that as we all start to look deep inside, do some self-reflection, do some self-analysis, and then come collectively together as an institution, we can start to look at ways in which we can make meaningful change in the lives of our students. And as the guest speaker spoke earlier, also in the lives of our faculty and staff. If there was anything that was illuminated for us during the pandemic, when we all thought that it was just the students who didn't have hotspots or internet connections, many of us found that our faculty didn't have internet connections. So I think there's an opportunity to seize on what we learned over the last 4 years, because it really came to the forefront. And I know for me personally, I had to take a step back and just like, okay, how is it that we can affect change? Because we can all look at the data, we can all look at the science, but what are we going to do about it?
Absolutely. Thank you for that. This next question is transitioning a little bit more to the CLNA process and the submission. And it's asking, if we consider your institutional geographic context, can you describe how your institution incorporates the labor market and community needs into that CLNA process and submission? So what might a more tangible example of that look like?
One of the things that we do, and I think I brought it up previously, is that we look at a variety of multiple data sets. So we're looking at our Lightcast data, which is the previous name was MZ, or Economic Modeling Systems, and we look at it both at a local area, which would be DuPage County only, and then the Chicago metro area. And we look at trends, and we make sure that what we're seeing there is in alignment with what our workforce data shows as well. And we identify, the growing industry, or the industries with the largest need. We also cross-reference that with what emerging occupations there are for our district. As I spoke before, we have a working group team that actually reviews that data and takes a look at it, provides a SWOT analysis of the labor market data, using aggregate and disaggregate data for those occupations, those growing occupations, to see if there's gaps in what we're seeing. We also have an open, what we call a comprehensive, or a CLNA open forum for both what we call internal partners, which would include our faculty and staff, but we have another one for external partners. so that we can get feedback and input from that group. In addition, we rely on survey data. We've done surveys to our employers as well as to our students, and to other stakeholders that we have, and we use that the results from that data to help us, gauge some of the labor market information.
Well, I would say that in the first year that we did the comprehensive local needs assessment, um, we took an opportunity, and I think I might have mentioned this before, but to work with some of our local economic development groups on various aspects of the plan. Because the economic development groups comprise a lot of local employers, and we're a heavy manufacturing area here, and then healthcare obviously is another big area for us. But we talked with local employers. We wanted to know, from a talent acquisition standpoint, how do they recruit their skilled labor to fill openings? What are they looking for in terms of employability skills? And a lot of that centered around the communications skills. And then we discovered that when you start looking at the communication skills and the technical skills, it's actually a blending of the two, because you have to know how to communicate regarding the technology and vice versa. But I would also say that, this time around, there's a lot of things that we learned the last time. But this time around, I too hope that we can look at this and create that external board, if you will, almost like an advisory board, to help inform some of what goes into our CLNA, and then also work closely with the WIOA boards, our One Stop. I know that our Perkins administrator, she works very, very closely with all of those entities. And then also just bring in, as I said, the internal groups, even including perhaps maybe some faculty on our groups, on those internal groups, because some of us, as administrators, we see this from a different perspective, perhaps, than maybe our faculty do. And so, like I said, there were some learnings that we gathered from the last time that we can look forward to implementing for this next time around.
That's great. I think ours is similar to what you did, Cathy. We reached out to some of our advisory committees. The college conducted an environmental scan. And again, this goes back to aligning this with your strategic planning process. But that environmental scan provided some really great insight. And then there was a survey that specifically went out to those advisory committee members, and there was engagement that way. And similar, we had feedback from that survey about skills that may be gaps for our students. And they were those professional skills. And as a result of that feedback, around about 2020, we had already embarked on shifting our institutional learning outcomes for our college. And so we moved away from those general education learning outcomes to common learning outcomes, and we reduced them from 11 to 5. And so a lot of our programs, when they think about assessment, they're thinking at the very course level, student learning outcomes, the program level, and now these common learning outcomes like communication, technology, quantitative literacy. So we've started to see how we can embed what we get back as far as feedback into our own processes so that we can better measure those things. Our students have to be prepared based on what the program says it prepares them for. And so I think it's important that that feedback came to us in that way at that time. But also we use LightCast. We have we utilize Career One Stop, and then Tableau, which internally helps for certain users to get data dashboard information. So all of those points have been useful, but certainly the feedback from our employers is critical.
Yeah, I wanted to add too that we use LightCast. I also use the BLS, the Bureau of Labor Statistics, as well. And then, of course, I think I already mentioned the WIOA, but Tableau, we have that as well. And we rely on our institutional research department as well to help us with a lot of this.
Thank you so much for that. I'm looking at our questions and I want to pick some that are a little more unique and engaged in the conversations that I've been hearing around CLNA. And I'm sure many of you have been having. So I want to go ahead and ask this question of what recommendation can you provide for staff, faculty, but also students in engaging students in this process? Often we hear be student-centered, but how can we actually engage students in this process?
Yeah, I think that is like a big missing component. And here we are, we're all putting together these plans to help our students, and we don't have their voice included in the plan. So I think it's incumbent upon us to work with students, and I don't mean just our student government folks either, because they will bring a lens to the conversation that I think will help inform us. But you know, we've got to get out into the hallways and just grab students from the hallway. We maybe work with faculty to say, you know, who are the students in your class who not so much are the ones who are always excelling, but the ones who have the potential and maybe don't say a whole lot in class. And so we have to find ways to create what I would call, um, you know, variations of students who can help inform this. And I would also say too, that it's incumbent upon us to make sure the demographics that we are collecting when it comes to students are representative of our community college. So for many of us, it would not always be just the 18 to 24-year-old demographic. We've got to have some adult learners in there. We've got to have some returning adults, some incumbent adults, some apprentices, you know, people who are already in the workforce, because they really have a viewpoint about what they are getting from a theoretical standpoint and how it's being used in the industry and how it's being practiced in the industry. And I would also say just one last group that needs to be involved in this. Again, we talk about equity a lot and we prepare our students for that, or we build these plans for our students for that. But what happens when they leave the college and they go to the employer and they don't experience these equitable opportunities? Somewhere along the line, we've got to get employers, the visionaries, the HR folks, on board to start talking about how they can align or match up with what, because you know they're discussing equity in their businesses as well, right? But what does it look like, and how do we marry the two? We've had instances here at our college where people have walked out of here, and I want to talk specifically about women in manufacturing, and it has not been a good experience. It has not been a good experience, but yet we're trying to attract more women into our manufacturing programs. You know, we have 4% of our population here in Elgin is Black, but we don't see that many Black students in these programs. So there's an equity gap. But yet when they get out into industry, right, somehow along we have to align these. And as educators, maybe that's the next step beyond the CLNA, is to start educating our employers.
Cathy, I really like what you just said. And it just made, so in the CLNA and ours, we also in that survey, it asked employers how many of them would, for instance, increase the number of women they hire, increase the number of minority, future employees they would hire. And there was feedback given. And so based on industry, we did gather some of that information, but it made me think of, well, why are some more likely to do that than others? And so I think those conversations need to be had. I like the idea of the impromptu feedback from students. I was thinking that to incorporate student feedback, we know we survey students a lot, and that return rate may be low. It may not be the best way to get the feedback, but having students know what this data says, like, have we shared snippets of this information with our students? And instead of asking questions, let's get their feedback, their reaction from the data, and build a conversation around that. And that could happen in the program meetings orientation settings, classrooms. You know, maybe this is something that can be embedded in the classroom in some sort of way.
I think what we did, I mean, even though survey data, and we were having trouble actually collecting and reporting special population data, especially the new special population categories identified through Perkins 5. And so in the fall of 2021, we did send a survey to every single CTE student. And we got a pretty decent response. We got 18% back. And what we really saw is that opportunity was not only number one to at least start collecting a baseline of representation in those special population groups, but to really ask them, you know, where do you see the barriers? What kind of supports can we provide you to make you more successful? And we did, you know, find out that it did reinforce what we expected. Technology needs obviously was the number one barrier that was identified, along with purchasing textbooks. So we did base our Perkins special population support on those survey results, so that we're better able to support those students as well. And we basically use that survey as twofold. One is to begin doing a better job of having the students self-report that data, but also then let them know by self-reporting this data, you'll have opportunities to get some needed supports to address those barriers that you've identified.
Absolutely. I did see a hand that was raised, so I just wanted to pause really quickly. If we have a question from Joanne Ivory, did you have a question for our panelists?
No, just a comment. I was listening to what everyone is doing with CLNA, and it reminded me of a gap that we found when we did our CLNA when we were collecting data. And I agree that we absolutely need to survey our students, and they do get tired of surveys. So I just put a table in at the end of the hall, and we do an unofficial survey to get information. But one of the things that was most telling, not only from a student standpoint for equity gaps, was from our employees. So our faculty never looked at, whoever comes to class, we will teach. There was no onus on the faculty to say, why is there the gap? Why is it that you only have 2 minority students in class? What are you doing? You can help, in that level of accountability. So we found that in our program analysis review, and our president took it to heart, and she convened a day and required everybody to come and take a look at that data, the equity gaps as it relates to your courses. So if you have 100% success rate and you have 1 minority student in that class, then what does that say about you? And it was extremely telling, because faculty owned it, that they hadn't thought about it. They were just teaching whoever showed up and didn't think about there was a larger problem. And one of the faculty members said, she said, and looking at the data, she said, my minority students in this class were wildly successful. She said, but the reason that they were so successful, she said, they also had a minority instructor. That faculty member was also a minority person. And just relating those, and I'm listening to the comments, is like, yes, it is. We have to get to our students. We have to get to our employers. But it's also important for us to step back and take a pause, because we have to do, and I know you guys have to do diversity training on campus, and we've had a lot of equity sessions, professional development sessions, because a lot of employees aren't connected to, they feel like, well, it's not my area. And to their point, you're not going to stay any place where you don't feel welcome. Which is why we are digging deep into the data and giving them, here your highest and lowest class of the success rates. And as part of the program review analysis, You have to tell me at least one thing you're going to do to change, to help to improve those equity gaps. So I just thought when you, as you all were talking, it's like, it's universal. It's the problem that we're all facing. And I think until, that we just have to bring everybody into it, from the maintenance, from the people that do grounds and maintenance to police, every single employee group on campus. Thank you for allowing me to share.
Thank you for sharing. I really appreciate it. I have a lot to think about from that, and from the wisdom that our panelists have already shared. But let's keep learning in community. Does anyone else have a question that you'd like to type in the chat, or perhaps our panelists would like to respond to Ms. Ivory?
Hi, Joanne. Familiar face and name there. Former colleague. I would like to just say that we're in the same place, right? I think all of us are struggling in some capacity with consensus and understanding around data and everything that is surrounding and impacted by the data that we have. For at the course level, we do have that data, and our faculty seem to look at that data more frequently than holistically at the program level. So there, when you talk about grades, which can be subjective, I think faculty are sometimes more in tune with looking at pass rates, percentage rates, how well students are doing, because it seems like it's a reflection of their teaching and not the students' needs. And so we've been trying to think about ways to reframe that. And even with conversations around assessment, which can be quite challenging, that this is not an evaluation of your teaching, but this is what the students are learning and how well they're learning the material that you are teaching. And so I would say one way, a strategy might be to try to reframe that and say, you can pay attention to this, you should, but let's take it back and center it around students and what students need and how they're performing. Although some of these might be indicative of other things, this is not your grading. This is not your teaching. This is what students need to be successful. And that goes back to centering this around equity and supporting students and what they need in those subpopulations. So we struggle with the same thing in different ways. We're in it too. We're trying to figure it out, but it's not an isolated concern. I feel you when you made that comment, because we are in it right now trying to figure out where do we go. And then we have so much data sometimes that to take a step back, as Cathy keeps saying, needs to happen almost every semester, sometimes every month, because it's just so much. We're so used to completing reports, but we have to, that's why I keep saying we have to operationalize it, because otherwise you don't want it to be a report sitting in a shelf, in a binder, on a computer. We have to, operationalize what we do.
I would add just one other thing too, Cherie, when it comes to Gianna's favorite word is assessment. But when we start thinking about assessment, I totally agree with you. It's more than just the grading, but it's also if you've identified who the students are in your class who are not performing well, then what kind of resources, what kind of interventions are you willing to put in place? But I go back to this one experience, or not, I shouldn't say one, but experience that we're having, whereby there is this interpretation or maybe perhaps misinterpretation of what is equity or what is an inequity, right? And so if we're not even all on the same page about how we define equity or how we even define inequities, then it puts us behind in terms of how we even think about what is the next step? What do I now need to do to address this? And we cannot default to something, is like they just don't get it, or they're just not willing to work at it, or they're just not willing to try. No, because at this point now we have to maybe, start to ask ourselves, what resources do we have here at the college? And then also, how do we reframe those resources? There's a colleague I have here at the college who says, in the previous institution he was in, Black students did not receive the word tutoring very well because it made them feel like they were less than. So now how do you reframe tutoring so that people buy into it, right? And don't think that it's something negative, because it's not. Even our president, he says here, even the smart people go to tutoring.
No,
So,
very true. Very
yeah.
true. It's everything that we've been talking about. It just drives home the need for more support for our faculty and staff too.
Mhm.
And what you said about you just can't say, no, we don't get it. You can't stop there. And just this is an idea. It doesn't work for every college, or it may not work for your college. But I know both OCCRL and Moraine Valley, we've started our own equity academy. And so we've been trying to promote faculty who are doing some of these special projects that are noted in CLNA to come forward, share their project, do more research. And in that, also as part of that equity project, someone developed that dashboard, because the subpopulations was necessary for the rest of the groups to be able to do the equity academy and to be able to get the data they needed at the course level to identify students. I recall when we first looked at the revised program review template, this was a few years ago, and it was the equity rubric really that we were testing out. We had a program that came through and said, I'll pilot this. It was our medical assistant program. And what we noticed is that particular program, they have minority students, but all of their students were Hispanic women. And so I asked the question of, how do we diversify your program, or are you marketing specifically to this demographic? How do you know in the community this is necessary only for this group of students, or is it in your process of how you admit students? So we really start to have those conversations, and I think they can happen at different levels of the college, whether that's with the department chair, deans, for CLNA, for program review, but the conversations have to be consistent and they have to be had. And I'll just leave with this note: we have to have some tough skin and be able to, be willing to have the conversation. It is uncomfortable. I noticed even with our own Equity Academy, those discussions can be uncomfortable, but we built a group of allies. So you were either an equity scholar or you were an ally. And I loved it when I saw faculty coming to say, I want to learn and I just want to be an ally. I want to support however I can. I'm not doing research, but I'm here to learn. And I think that's sort of the shift in the culture that may have to happen for us to really do this work.
Yeah, my saying is, you have to be comfortable being uncomfortable.
Mm-hmm.
Yes, I think that's so important to remind all of us that we are not entitled to our comfort in the spaces that we are working on, especially if we are trying to center equity in those spaces. So thank you so much for bringing that up. I want to thank you especially, Dean Demeter, for that beautiful wrap up that you just gave us. And I wanted to invite our other two panelists if they had any additional words of wisdom that you want to close with.
One of the things is, as far as a practical note, and especially if it's your first time in doing the CLNA, is really, use existing your existing information, your existing data reports. Collaborate with a variety, as many as you can, of different groups. And you'll if you have working teams on taking each one of those sections, I think you'll find that the work becomes easier and it becomes meaningful, because the more people you can have involved, the more buy-in you'll have, and it becomes more of a working document as opposed just to as opposed to just compliance.
I will echo everything that Gianina just said. And I would encourage, everyone, as we dive into this for another round, that we come into it and we use the experience that we had the first time around. Because I do believe that because of the Perkins 5 legislation, that was everyone's very first time. But we've learned a lot over the last few years. And let's take those new learnings and apply it and integrate it into our new plans coming forward, because there's opportunity for growth, there's opportunity for improvement, and the more we do that, the better we get at this.
Absolutely. I would like all of our guests to utilize those reactions or the chat to thank our wonderful panelists for sharing their wisdom and their expertise with us. I truly appreciate it. And without further ado, I want to turn it back over to Dr. Baker to close us out.
Thank you, Kuneyl. I appreciate you for moderating the panel session. The claps are for you as well. Kuneyl serves as a research assistant here in our office, and I think did an excellent job trying to help us learn a little bit more from our panelists. And thank you absolutely to Jonita and Cherie and Cathy for sharing again your wisdom. This is more to be learned. We have lots of ideas off of what you said, so we'll be in contact. As you all know, you three are definitely people, really good relationships and resources for us. So thank you for sharing. And thank you to ICCB. I see at least a couple people, Janelle Washington and Tasha Allen, for joining us and for the support in this work. We continue to think, help you all think through, what some of those needs are, and provide you hopefully with some up-to-date research in the areas that you've said that you needed some help with, right? In terms of equity and outcomes, implementation strategies, and others. I appreciate you, Cherie, for bringing up the Equity Academy. Stay tuned for that. If you haven't joined our mailing list, please do so. There will be some opportunities to get together to talk more. And we have both the spring and summer Equity Academies that we're planning for. And so you'll see more of this content, as well as, pushing in a little bit deeper in some of those spaces. So thank you all for attending today. Dr. Anglin's presentation for Alice, I hope was enlightening for you and something that maybe you'll spend your afternoon researching, looking a little bit more into that data. If not, maybe the weekend, who knows? We all love data, right? Lastly, thank you all for joining me. I think we had about 40 people regularly on from the time that it started till it ended. So you definitely were engaging, right? Kept the audience entertained. And so thank you all for stopping by this afternoon. And with that, please do feel free to leave. Thank you. Enjoy the rest of your afternoon, and we'll see you soon. Bye.